Artificial Intelligence Dr. www.abcpharma.net/English. What are all possible side effects of a general anesthesia lasting 3 hours? Here is a list of possible short-term and long-term side effects associated with general anesthesia. Short-term side effects. Nausea and vomiting. Nausea and vomiting are common side effects of anesthesia, often referred to as postoperative nausea and vomiting, PONV. These symptoms can occur immediately after surgery or within the first 24 hours. Dizziness and grogginess. Patients may experience dizziness, disorientation, and a feeling of grogginess upon awakening from anesthesia. These symptoms usually resolve within a few hours but can sometimes persist for a day or two. Dry mouth and throat. Anesthesia can cause dryness of the mouth and throat, leading to discomfort and a temporary change in taste or voice quality. Staying hydrated before and after surgery can help alleviate these symptoms. Sore throat. Some patients may experience a sore throat due to the placement of a breathing tube during anesthesia. This typically resolves within a few days. Muscle aches and pains. General anesthesia can cause muscle relaxation, which may lead to muscle aches and pains in the postoperative period. Gentle movement and light exercise can help alleviate these symptoms. Confusion and memory loss. In some cases, anesthesia can lead to temporary confusion, memory loss, or disorientation. This is often referred to as postoperative cognitive dysfunction or post-op fog. It usually resolves within a few days to a week. Itching and rash. Anesthesia can occasionally trigger itching or a skin rash, which may be localized or generalized. This is typically mild and self-limiting. Shivering and chills. Shivering and chills can occur during or after anesthesia due to changes in body temperature regulation. Warm blankets and appropriate clothing can help alleviate these symptoms. Long-term side effects. Delirium and cognitive decline. In rare cases, prolonged or repeated exposure to anesthesia, especially in older adults or those with pre-existing cognitive impairment, may contribute to delirium or long-term cognitive decline. Postoperative cognitive dysfunction. Some patients may experience prolonged cognitive dysfunction, including issues with memory, concentration, and executive function. This condition, sometimes referred to as postoperative delirium or POCD, postoperative cognitive dysfunction, can persist for weeks or months. Respiratory issues. Anesthesia can affect respiratory function, and in some cases, patients may experience respiratory depression or respiratory complications, such as pneumonia or atelectasis, especially if they have pre-existing lung conditions. Nausea and vomiting, prolonged. While PONV is typically short-lived, some individuals may experience prolonged or recurrent nausea and vomiting, which can interfere with eating, drinking, and overall recovery. Addiction or dependence. Prolonged exposure to certain anesthetic agents or opioids used during surgery may, in rare cases, lead to the development of addiction or physical dependence. It's important to note that the side effects of anesthesia can vary widely among individuals, and the presence or severity of these effects may depend on factors such as age, medical history, medication use, and the specific anesthetic agents used. Most side effects of anesthesia are temporary and resolve within a few days to a week. Claude. The possible side effects of general anesthesia lasting 3 hours can vary from person to person, but some of the most common ones include nausea and vomiting. This is a common side effect that can occur due to the anesthetic agents used and can last for several hours after the procedure. Sore throat. The breathing tube used during general anesthesia can cause irritation and soreness in the throat. Confusion and disorientation. Some patients may experience temporary confusion, memory loss, or disorientation upon waking up from anesthesia. Muscle aches. Patients may experience muscle pain and stiffness due to lying still for an extended period. Itching. Some anesthetic agents can cause itching sensations on the skin. Chills and shivering. Patients may experience chills or shivering as their body temperature regulates after the procedure. Bladder problems. Difficulty urinating or bladder discomfort may occur temporarily after general anesthesia. Dry mouth. Anesthetic agents can reduce saliva production, leading to a dry mouth. Fatigue. Patients may feel tired and groggy for several hours or even days after the procedure. Less common but more severe side effects may include allergic reactions to anesthetic agents, breathing problems or pneumonia, cardiovascular issues, such as blood pressure fluctuations or irregular heartbeat, nerve damage or weakness due to positioning during the procedure, cognitive dysfunction or delirium, especially in older patients, blood clots in the legs or lungs, malignant hypothermia, a rare genetic reaction to certain anesthetic agents. GPT-4. General anesthesia is a crucial component of many surgical procedures, ensuring that patients remain unconscious and free from pain during the operation. A 3-hour duration under general anesthesia is relatively common for more complex surgeries. While general anesthesia is generally safe, there are several potential side effects and complications, some of which may be more likely or pronounced due to the longer duration of anesthesia. Here's a breakdown of possible short-term and long-term side effects. Short-term side effects. These effects typically occur immediately after anesthesia and usually resolve within hours to a few days. 1. Nausea and vomiting, common after general anesthesia, often caused by the drugs used or the body's response to anesthesia. 2. Sore throat or hoarseness, due to the breathing tube, endotracheal tube, used during the procedure. 3. Drowsiness and confusion. Feeling groggy or disoriented upon waking is typical, especially in older adults or those under anesthesia for extended periods. 4. Shivering and chills, a reaction as the body's temperature regulation is disrupted. 5. Dry mouth and thirst, caused by fasting before surgery and the effects of anesthesia drugs. 6. Muscle aches, from lying in one position or the use of muscle relaxants. 7. Headache, due to dehydration, stress, or effects of the anesthesia. 8. Dizziness or lightheadedness, from changes in blood pressure or dehydration. 9. Bladder dysfunction, temporary issues with urinating due to the effects of anesthesia on the bladder muscles. Long-term side effects. These are less common but can occur, especially in vulnerable populations or after prolonged procedures. 1. Postoperative cognitive dysfunction, POCD, in older adults. Prolonged or repeated exposure to anesthesia can lead to cognitive issues like memory and concentration problems, lasting days to weeks or longer. 2. Malignant hypothermia, a rare but severe reaction to certain anesthesia drugs, causing a dangerous increase in body temperature and muscle breakdown. 3. Respiratory complications, including pneumonia or respiratory failure, especially in those with pre-existing respiratory issues. 4. Allergic reactions, ranging from mild skin reactions to severe anaphylaxis. 5. Nerve damage, rare, but can occur due to positioning or direct injury during surgery. 6. Blood clots and venous thromboembolism. Risk increases with the duration of both the anesthesia and the surgical procedure. 7. Aspiration pneumonia, if stomach contents are inhaled into the lungs, especially if guidelines for fasting weren't followed. Risk factors and precautions. Certain factors increase the likelihood of experiencing side effects from general anesthesia. 1. Age. Older adults and very young children may have more pronounced side effects. 2. Medical history. Pre-existing conditions like heart disease, lung disease, obesity, or neurological disorders can increase risks. 3. Type of surgery. Invasive or longer surgeries increase the exposure to anesthesia and potential complications. 4. Lifestyle factors. Smoking, alcohol use, and general physical fitness can influence recovery from anesthesia. Management and recovery. 1. Preoperative assessment. Thorough evaluation to tailor anesthesia to the patient's health status. 2. Monitoring. Close monitoring during and after surgery to detect and manage side effects early. 3. Postoperative care. Strategies to mitigate nausea, pain, and other discomforts, including medications and gradual rehydration and nutrition.